Hi, my name is Craig Blake with Amsive Health, part of the agency growth team here at Amsive Health. And at Amsive Health, we work with providers and payers and helping them basically grow. And we use that through full service suite of marketing capabilities. We're all driven by performance, and that comes from our roots in data. And we're really leveraging data, both first party and third party, to get clients to achieve the results they need. And the key thing is on the hospital system side is really using that anonymized claims data, which allows us to really pinpoint and target campaigns. And that allows us to drive the growth a practice or a health system really is looking for. One of the topics we hear a lot about these days, one of our core roots is on the SEO side. Agency on the digital arm was built on the SEO side. So of course, AI is everywhere and LLMs are everywhere. What we're really consulting and helping clients really get to the next level on is how do they become part of the searches when consumers are now going on their phones, going to ChatGPT, they're going to Google, and they're typing in, my kid bruised his, you name, arm, leg, foot. They're diagnosing it. So they're skipping actual initial visits because they're thinking they can figure it out on themselves. The reality is two things are happening. One, you're missing the patient appointment, but two, you're never part of the consideration set, even if you're down the road from that family who's on their phone. So how we're helping clients do that is really thinking about holistically. SEO is still important. AEO or GEO is still very important, but they need to work together. So you have to have strategy to solve for both. Unfortunately, not every client has the team members that know that. So we're helping them figure that out, understand how to do that, because the reality is if you're not part of that conversation, it's lost revenue and lost growth opportunity for our clients. Ownership is a big part of the challenge, right? Who owns it? Is it a marketing or is it a web dev function? The reality is both. So it really becomes an opportunity for health systems to link arms and solve this challenge together. And you know, we heard here at HMPS a little bit of the challenges of who owns AI? Where does that live? There's a lot of from governance to compliance to tech, or is it the marketing function? So I think this falls in that same category. You got to identify who the owners are, and then you can start solving it. So another area that we're seeing a lot of, or getting a lot of interest in is data. And here at Amsive Health, our foundation for 30 years has been in data. In fact, we started as a data company 30 years ago. And it's always, how do we leverage client first party data to be as smart as possible in building out campaigns and campaign strategies? Now, in today's world, there's so much data available on the exterior market. We call that third party data. But the silver bullet that we're able to layer in is the claims data, anonymized claims data, which allows us to help build models based on conditions. So we can talk to people that have high propensity for condition A, B, or C and align that with service lines. So we can start doing hyper targeted, not just on service line growth, but also availability at a practice or at a provider. Because those two need to work in concert. It's not just more patients. It's more patients that can be seen, because if they can't be seen, no one's making any money and the growth equation goes away. The last piece on the data, it's all about attribution and being able to tie the investment of marketing into the result in that new patient. And that's where we see a lot of health systems struggle. Full story is not being told. And the end result is it's hard to get investment from the CFO, and it's hard to get leadership behind it. So by using data to help tell that full life cycle story, it actually puts you in a better position to elevate marketing within a health system. And that's something we see under siege right now. Marketing leaders in health systems aren't in the room of senior leaders, and that's a challenge. And we're seeing titles being eliminated. And I even heard people through the conference saying they're not calling themselves marketers anymore. As a person that's been doing marketing for 30 years, that scares me. And I think we need to make sure we have the data to help build confidence back up in the tool that marketing is to help drive growth at a health system. One of the things we've been celebrating this year as we turned our calendars to 2026 was the launch of Amsive Health. At Amsive, we've been doing this for over a decade, but our healthcare vertical is our largest vertical within the agency. And we work across colleges and universities. We work in the insurance vertical, we work in the consumer goods vertical, but healthcare has been our largest growth over the past couple of years. And with that, we spun out our healthcare division and named it as Amsive Health and has its own landing page and microsite and all that. And it's really a recognition of our commitment to helping not just one side of healthcare, but healthcare holistically. And that crosses payers and providers in multi-location facilities. So we're really excited about it. We've got a lot of energy behind it, and you'll be seeing us out and about more and more.